Hello everybody, my name is Naveed Sattar. I am Professor of Metabolic Medicine at the University of Glasgow. I'm delighted to chair the IDF sessions on cardiovascular disease and hypertension. These sessions will cover assessing cardiovascular risk and diabetes and all the modern techniques that we have available, as well as looking at cardiovascular risk in pre-diabetes, also by gender and ethnicity, and also trends over time in cardiovascular risk in different parts of the world, which is a really important topic. We're going to go beyond the usual treatments of hypertension and dyslipidemia and how we treat them, but also consider in depth where GLP-1 receptor agonists and SGLT2 inhibitors come into play, and review all the recent evidence. And finally, we're going to cover really the thorny but important topics of heart failure and diabetes, as well as peripheral arterial disease. And we will also round up and looking at some other controversial topics as part of this, including when do we consider aspirin therapy, what about the role of fish oils, etc. When we think about the main drivers of cardiovascular risk in people living with diabetes, we traditionally have focused on hypoglycemia. But we also have recognised in the last 10 to 20 years that high blood pressure and tackling LDL cholesterol also substantially lowered the risk of cardiovascular disease in patients living with diabetes. And those factors are particularly important to tackle because we have low-cost interventions that can make substantial benefits all over the world in patients living with diabetes. However, beyond that, we've now recognised that there are other factors that we don't fully understand, but which SGLT2 inhibitors in part and GLP-1 receptor agonists also in part will mitigate and lower cardiovascular risk. These factors include hemodynamic aspects linked to cellular overnutrition, and of course the other big factor that particularly GLP-1 receptor agonists tackle may be excess weight and ectopic fat. And ectopic fat seems to be another driver for cardiovascular risk, so one of the factors that we really need to consider going forward is more interventions tackling obesity or excess weight in our patients living with type 2 diabetes.